Welcome to Hersing University NU 640 Introduction to Women's Health Across the Lifespan. This video will discuss Chapter 3, the Health History, from your Holland and Secor textbook. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapter for additional and required information. Additionally, I would like for you to review all other required and supplemental resources. This presentation will be narrated by Dr. Alicia Sutton.
I'm not going to spend our time discussing every detail that is required to perform a proper in-depth health history. Instead, I want to build on your previous health assessment course. The purpose of the health history is to establish a relationship with a woman while learning about her health. To a great extent, taking a health history means listening to her story. Both the content and the manner of which she conveys provide important information for a provider's understanding of what an individual woman wants and needs. I think that we can all agree that the health history, including the sexual history, is by no means a dry or straightforward subject. It involves people's relationships, their lifestyles, and their self-identities, and it can be very emotion-laden territory. For providers as well, the language and the explicitness of the questions can be very difficult. So I want to emphasize that this is not a talent, but rather skills to learn and practice. Depending on the clinic that you will be at, you may or may not have access to a written form to jot down your interview. Some students in the past have created their own form to assist them in covering all necessary components. If you do so, always remember to be compliant with HIPAA and leave off any patient identifying information. To optimize health history taking, several environmental and logistical arrangements should be consistently in place. These include providing a comfortable and private setting, scheduling an appropriate amount of time, and choosing the optimal format and staff member for obtaining the health history. Initially, the provider will introduce themselves, state the purpose of the visit, and invites questions from the woman at any point during the visit. Next, you will need to check basic demographic information, which is less personal and helps put the woman at ease. Begin with open-ended questions, asking, "How may I help you today?" or "What has brought you here today?" These are good ways to begin determining what is traditionally referred to as the chief complaint. This will give you a chance to reveal what is important to the patient. The woman should be encouraged to describe the problem or reason for the visit in her own words. For example, "I think I want to change my pills to an IUD." When the woman has finished describing the reason for her visit, you will need to then dive deeper into the issue. To maximize understanding of the woman's problems, you should ask the following questions. What were the circumstances at the time the problem started? What has been the sequence of events for symptoms? Are they improving or worsening? Has a problem occurred before? If so, what were the circumstances of the previous occurrence and what led to its disappearance or resolution? To what extent is the problem interfering with daily life or relationships? Which questions does the woman want answered today? What is the woman expecting from today's visit? Have other steps been taken to solve the problem? If so, what were they and how effective have they been? Remember, you're going to want to document the history of present illness using the old cart approach. The past medical history should include any past illnesses or diagnoses, conditions, traumas, hospitalizations, and surgical history. You will want to include the dates, if at all possible, as well. Review all medications the woman is currently taking, including over-the-counter preparations and complementary therapies, and reasons for their use. If the woman cannot recall the name of the medication she's using, encourage her to bring the package to the next visit or contact the pharmacy that she uses. You'll also want to describe allergic responses to medications, foods, or any other substances. In regards to the social history, you'll want to inquire about her highest educational level attained, marital status, significant relationships, and employment history. Additionally, information about housing, financial status, family relationships, and potential and actual stressors or social problems should be elicited. In regards to substance abuse, perhaps the easiest way to proceed with this topic is to inquire about each substance separately, beginning with the legal and most commonly used substance, which is tobacco, then continuing to alcohol and ending with illicit substances. When inquiring about tobacco use, find out if the woman has smoked or is currently smoking, the number of cigarettes, the length of time smoked, the number of attempts at quitting, and any interest in quitting now. Then ask about alcohol and illicit drug use in the same manner. To detect problem drinking, use several well-validated short screening tools. The most widely used screening questions are the CAGE questions. It is important to note that you may see this on your board exam. For that reason, I suspect you are all familiar with the CAGE questionnaire. Have you ever felt you ought to cut down on drinking? That is the C. Have people annoyed you by criticizing your drinking? That question is the A. Have you ever felt bad or guilty about your drinking? That is the G. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? This is an eye-opener and is considered the E. C, A, and G generally become positive around the same time. However, E, the drinking in the morning time, is generally much later in the disease process and is often missing from binge drinkers because those that have to drink in the morning usually do so to prevent withdrawals. I would like to also briefly touch on calculating a pack year history. Calculating a pack year history is a way to quantify tobacco use, and the formula is the number of packs per day times the number of years smoked. I've included some examples, and let's say that she has a 40-pack year history. She hears a message from you today and she quits smoking. Do you stop documenting her pack year history in her health history? No, you do not. She will carry this pack year burden for the rest of her life. Moving on to obtaining a family history. Of course, I've not included all areas that need to be covered on this slide, but it gives you an idea. Gather information about first-degree relatives. This includes parents, grandparents, siblings, and children. Always include genetic factors, environmental conditions, and lifestyle choices, because a family history also can provide information about the risk of rarer diseases caused by mutations in a single gene, such as cystic fibrosis and sickle cell anemia. In regards to the health maintenance and promotion, you'll want to inquire about her immunizations, exercise, sleep, and nutrition patterns. Be sure to also include safety issues, primarily the use of seatbelts in motor vehicles and helmets with bicycle or motorcycle use. Because of the high prevalence of physical, sexual, and emotional abuse, many authorities recommend the routine screening of all female patients for domestic violence. As with other sensitive topics, start this part of the interview with general, normalizing questions such as, because abuse is common in many women's lives, I've begun to ask about it routinely. Or, are there times in your relationships that you feel unsafe or afraid?